As we continue our back-to-school coverage this hour, we are focusing on something that is in every school across every county in our area. Teenage acne. Now, most teens get it. It can range from maybe the occasional pimple to the severe stuff. And with so many kids back to school now dealing with this, it can just add to their stress, and we don't want to do that. Joining us this morning to help us guide us through this problem and really kind of talking, quite frankly, about what causes it and the latest and greatest is Dr. Kalpana DePasquale. I'm sorry. I know that happens to you all the time. It happens with me with my last name as well. And her son, Ryan, who's being a good sport and joining us here, even though your skin looks fantastic, by the way. I mean, you are perfect. You're, a great poster child for this. Let's talk, if we can, Doc, a little bit about what causes this. Should we assume that if a parent had bad acne growing up, that our kids will have that?
You can't really assume that, but there is a genetic predisposition to acne. But the other factors can also be obviously hormonal, which is a big issue amongst our adolescents. And sometimes it could be the products they're using could be contributing to acne. So it's usually multifactorial. The interesting thing is diet is often implicated in the cause of acne, but there's really no research to support that.
Really? So you can eat as much chocolate as you want, and that's not going to cause it, or any greasy foods? That's just a myth.
That's a myth, but
really?
That being said, it's always important to have a nice, proper, healthy, nutritious diet because, you know, good skin comes from the inside out. So eating all those things may not necessarily make your skin look great, but probably isn't going to be implicated in acne.
And you mentioned that there are some things that you can be treating your skin with that you don't realize could be making it worse. Is there anything in particular that's very common that maybe our viewers would like to know about?
Sometimes, you know, no products in particular, but sometimes children will start using a product and they'll react to it. They can have dryness, flaking, aggravation of their skin, and that's important to take note of. Also, the chemicals that are found in quite a few of the products may be agitating to their skin as well. So it's just important to read the labels, as always, and make sure you know what you're putting on your skin.
So we're going to talk about latest and greatest in just a minute, but I'd like to talk a little bit to Ryan because, Ryan, you know exactly what this is all about, too. I'm still finding it hard to believe, but your mom said that you had some pretty severe acne when you were a little bit younger. Tell us what that was like for you going to school, and, you know, it can be a little embarrassing.
Yeah, I felt embarrassed and just left confident with myself.
And what are you doing now that, I mean, your face looks fantastic.
I'm pretty much just using her products.
Really? And it cleared it up that quickly?
Yeah, the Wipe and Go pads work wonderful.
Okay, well, let's talk about that a little bit. Yeah, you have show us what you have here. And these are products you've come up with.
Yeah, these are my own products that we formulated. This is for women. These are the essential exfoliating pads, and the Wipe and Go pads are for the men. So they basically, what's nice about those is that he can take them with him when we're on a plane traveling, or if he just wants to take them to school, he can. He usually doesn't, but they're easy because sometimes children don't have a lot of time or they don't have a lot of commitment to taking care of their skin. So this is great because he could just get out of the shower, wipe his face, and go.
Well, because the hygiene part is, I mean, I know just with my 10-year-old, I can't get him to brush his teeth. So
exactly.
You can imagine that they're kind of running and they don't think a whole lot about it.
Exactly.
Let's talk a little bit about cost, and then it's interesting here because these are products that you don't ingest. Because I think that a lot of parents, do you find, are a little ambivalent about having their child take something like a medication.
That is correct. There's a lot available as far as acne treatment. So sometimes if, you know, topical things don't control the acne, that may be really your next end point. There are available, you have topical antibiotics that are available, you have oral antibiotics that you could be using. Accutane, of course, is there. But a lot of parents, I feel, share the same concerns that I did with my son. They might not want, I mean, it may be necessary for some people, but sometimes that's not the first place we'd like to go. We'd like to try a couple of other things first.
And I know you have some things that are kind of over the counter. Any ones in particular that work the most effectively, have you found?
I don't feel there's a magic bullet for acne because the bottom line is not everything works for everybody. So I usually take a thorough history of what they've used in the past and what's worked. My feeling is if something works, great, use it. But when it doesn't work, you need to try something else. Most of the over-the-counter preparations will contain benzoyl peroxide, salicylic acid. It's important to note the percentages of those things. And, you know, after that, you know, there's no, again, all these products are available. He's tried quite a few of the over-the-counter products and nothing really worked. Everything just irritated his skin. Then again, he's half Italian, half Indian, so you know, there's some ethnic component there too, and that becomes a little bit more difficult.
But there's, how much is your product?
It depends which product in particular.
Yeah, the ones that you're
So that one is $44 because it's got lactic acid, glycolic acid, kojic acid, and and also the salicylic acid. And the reason behind that is that the combination of the acids helps exfoliate and also lighten any kind of hyperpigmentation that may occur. For him in particular, that would occur when you get acne because of the skin color. So the combination just tends to work great for him and quite a few other people. Is it a magic bullet? No, nothing is.
very much, Doctor, for being here. I do appreciate it.
Nice.
Ryan, you're a great sport. Thanks for coming in. You look fantastic. All right, it's 8:22 this morning. You know, for information on topics like acne and losing weight, you can go to newsforjax.com. Just look under the health tab.